Good afternoon. I'm Tanya Winders, the President and CEO of Allergy and Asthma Network. This afternoon, we'll be looking at asthma and COVID-19. Is research really that important to me? Let's begin with a few housekeeping items before we get started. Sorry about the background noise. I'm in an airport this evening.
We are all in this together.
Let's start with a few housekeeping items. First, we will be recording today's webinar. It will be posted on our website within 48 hours. Each of your lines will be on mute for the entirety of the webinar. Should you need anything, feel free to post a question in the question box or the chat, and we do have a team that will be monitoring that and getting back to you. The webinar will be approximately 1 hour in length, and we will leave time for questions. Please post those questions in the question box of the control panel at any time throughout this evening's program. We'll now pause for just a moment while we begin the actual recording of the session. We welcome you to the fourth in our series of Black People Like Me webinar meetings, funded by the Patient-Centered Outcomes Research Institute, PCORI. I'm Tanya Winders, the President and CEO of Allergy and Asthma Network, and it's my pleasure to welcome you this evening and to reinforce that we are here because we all desire to end the needless death and suffering due to allergies, asthma, and related conditions like COVID-19. We do that through 4 mission areas: outreach, education, advocacy, and research. And tonight we'll be talking about many of those areas. Today's program is titled Asthma and COVID-19. Is research really that important to me? You can see that I have my illustrious co-host with me again tonight, Dr. Leroy Brown, and this is the program that we will be covering. We'll have a short COVID-19 update, and then we'll turn towards real-world research study and outcomes data. Then we'll be talking about participating in research beyond being just a subject. Oftentimes in research, you'll hear researchers refer to patients as subjects, and we always say we really don't like that term. So this will be an interesting conversation about being more than just a subject. And then how to get engaged in PCORI research or PCORI research, patient-centered outcomes research, and then our Q&A time. And then we'll follow up with a few closing remarks before we close our time together. These are the things that we'll cover in tonight's webinar. First, what are the perspectives of Black patients that have been shared with researchers regarding COVID-19 and getting the vaccine? We want to hear what they have had to say. Secondly, how can Black asthma patients and caregivers engage in this new approach to research called patient-centered outcomes research? And how will it make a positive difference in the African American community?
Unattended baggage is subject to search.
Finally, how including patient perspectives in research helps people and their caregivers communicate and make more informed decisions in their healthcare. So again, we have a very illustrious panel tonight, and I want to briefly introduce them to you, and they'll introduce more as they speak. First, Dr. Sharon Allison Oddie. She's the Executive Director of COSHAR Healthy Communities Foundation, and will provide us some really valid information and insights from the African American community in regard to vaccine hesitancy. Second, Courtney Clyett. She is a Senior Program Officer for Engagement at the Patient-Centered Outcomes Research Institute, PCORI. And thirdly, Mary White, a patient advocate and research advisor who has been working with us in the Black People Like Me project over the last several months. Now let's get started with our very first polling question tonight. Do you participate in research? Have you ever participated in research? So I'll launch the poll and you can go ahead and interactively participate, yes or no. We do have about 800 plus people on the line tonight that have registered for the event. So we'll give it a few moments, give it just a second, let people log in their response. Do you or have you participated in research? Yes or no?
check with your bag.
All right, we'll share the results. What you can see is that 57%, so over half of those on the line, have participated in research tonight. That's very high compared to the general population. And 43% have not. So about 50-50, just over 50%. Really, I think that this is, again, a very educated, empowered community that is activated through this particular webinar. And we're excited that you're here with us this evening to learn more about research and patient insights. So now I'm going to turn it over to Dr. Graham, and he's going to provide our COVID-19 update this evening. Dr. Graham?
Thank you. Well, we made a lot of progress, and indeed, some states are indeed opening 100% without the use of masks. We've also had the recent announcement of a new vaccine approved by the FDA in February of 2021, the Johnson & Johnson vaccine, the Ensemble 2. It's important, though, however, to realize that even those who have been vaccinated need to practice being safe. That kind of collective behavior is a very good thing for all of us. And from personal experience, I'll share with you, I've got my second Moderna, but I still practice social distancing when I'm out in a community where I'm often an example. I also have something to share. One of my best friends is recovering from COVID, so I get a firsthand view of what this is like. If we look at data, we now have nearly 30 million cases. Just in the last 7 days, at a time when the messaging is going out that the virus is going down in terms of infection, we've had 500,000 cases. And sadly, the state is a little bit behind. We have had 526,000 deaths, okay? You'll see on the left a map that shows the distribution. And indeed, the involvement and engagement is different in different states. I encourage everyone listening to look to your local medical community and the people that are giving information to get the most firsthand. But it's important to realize that cases are still increasing, and it is important that we continue to do safe practices, social distancing, mask wearing where appropriate. And indeed, everyone, regardless of your color, regardless of your preference, should really be trying to get the vaccine. Many large cities and large metropolitan areas are opening large venues now to do mass vaccinations. They are taking caution in that you are not going to be exposed unduly, and so getting the vaccine. But indeed, having had the vaccine now for about 6 weeks, I feel much safer, though I still continue to do the safe practices that I advise.
Thank you, Dr. Graham. And now we're going to turn it over to Dr. Allison Oddie, Executive Director of COSHAR Healthy Communities Foundation.
Hi, thank you all for having me. And it's such a pleasure to be here. We're going to get right into it. I am going to present data from the COSHAR Foundation. The COSHAR Healthy Communities Foundation is a nonprofit organization that is now in every state. We are not a faith-based, and it's important, especially when we drill down to some of the data, that we are not a faith-based organization, but we do work with and utilize a faith-based community in our outreach models. We have over 78,000 plus houses of worship of every single denomination that is a credible denomination in the US. We also have some international members which are not listed here. And we also have community organizations of over 2,600 and continue to grow, as well as partnerships, a huge health professional volunteer network of physicians, nurses, and every aspect of the health professions and volunteers all over the country. Now, getting to the meat of my part of this is we have conducted what we have seen to be the largest scientific surveys of African Americans / Blacks on perceptions on COVID-19 and specifically potential vaccine engagement. We all hear the news that there is some vaccine hesitancy in minority populations based on several reasons. Well, we like to go to the source, and so we were able to go to over 3,000 persons in a scientifically based survey that told us what we wanted to know to help shape our engagement in communities. And the focus is Do you know what COVID is? What are you thinking about vaccines? Do you know someone with it? These next few slides really just talk about demographics. And I wanted to show, and I'm biased because I think women lead the way often. So women, men, you see the breakdown, transgender, next slide. And the age groups, and we heavily sampled the 40 to 69-year-olds, and then you see the 70 to 79-year-olds. Next slide. And then this is important. Anytime we talk about health disparities, we talk about socioeconomics, you have to include socioeconomics and education, and you can see the distribution of education, of self-identified education of our respondents. And this is almost a mirror of where urban populations are, and we overly sampled. I want to say again, these are primarily persons that identify as African American or Black. That was the target. And you see that if you were to transpose the map, you would see that we went where the money is, and that's where the answers came from, highly urban areas. And then this is employment status. Next slide. And you have to always look at socioeconomic. So we made sure that we did collect that data as well. This does not deviate far from standards in the US. So let's get to the data now. 100% of respondents were familiar. Our first survey was really April 2020, where we did a lot of questioning. Do you know what COVID is? 100% were familiar with the term coronavirus or COVID. And then the issues of, do you believe COVID is a hoax or is it a real disease? Of those participants, you see the majority said yes. 96.3% said yes, it's real. And then we asked, and there is a difference in the two, have you been diagnosed with COVID? And the April survey, 7% said yes, roughly, versus 13% in September. And then, are you afraid? And fear is driving a lot of actions. Are you afraid that you or someone in your family will contract COVID? 93%, and even higher in September at 97, almost 98%. Do you know anyone, family, friends, work associates, that has been hospitalized? In April, it was 28.4%, and there was a huge jump, obviously, in September to 41.2%. And then death rates, 19.3% of the respondents said in April, I know someone who died, versus 26.8%. And then finally, for this slide, anyone who has tested positive, 61% in April versus 78.3%. So obviously, has the virus took more steam, you see that everyone, and now literally, I doubt that there's anyone in the United States or in many parts of the world that don't know what COVID is and have not been affected. Next slide. So now, these are things that we're answering now. If the vaccine, and certainly if the vaccines are available, would you get vaccinated? Initial survey said 14.3% said yes, but 69.1% said a definitive no. 16.6% said I am unsure. This is key. You are hearing, and we're hearing about hesitancy in the African American community. This is the data. Would you recommend that your family that your family be vaccinated? Only 9.8% said yes. And remember, African Americans have higher rates of death and complications. So these are alarming. Do you believe, key, that the development process of COVID-19 is safe for the public? We believe and know from our focus group that this is driving a lot of the hesitancy. Only 6.2% of those surveyed said, I believe that this was a safe process. And then, do you believe that the vaccine should be targeted to African Americans, Blacks first? And this is key because of the risk factors and death rates. Most would say, well, if they're having worse outcomes, yes. Actually, in our survey, only 1.7% said, I believe that it should be targeted to African Americans and Blacks first. And we'll get into that in the discussion. We talked about, and you can see on the slide, would you trust your primary care physician? 19.1% said yes. Unsure at 77.1%. Would you participate in a clinical trial? Very low numbers. Would you participate in a vaccine clinical trial? Very low numbers. A little bit of a bump when we talked about treatment clinical trials, 18.5%. Remember to be in that. Again, this is treatment, not vaccine. And then, do you trust, and we're going to trust now, information given by Dr. Fauci and the National Institute of Allergy and Infectious Disease on COVID. A whopping 83.6% said, yes, we trust the information, but you have to overlay this with going back to, would you recommend your family member be vaccinated? So you trust the information, but you're still hesitant. And at the time we had another president. Do you trust the information given out by the White House, President Trump, on COVID? Only 1.4% said yes, with the majority saying no. And other government officials, again, mistrust of the healthcare system. This is not new for many of us that have worked in this field on health disparities and health equity. There is a huge chasm of trust. Do you trust the information given by the pharma industry? 59.4% said no, and 32.5% said I am unsure. But this is where we are, and I told you all we have over 78,000 houses of faith, particularly in African Americans. We know that doctors can say whatever in the exam room, on TV, whatever, but if a faith leader says it, it has a lot of weight. Compare. Do you trust the information shared by your pastor or faith leader or member of your church or community or health ministry on COVID? 71.4% said yes, versus 19.1% similarly to physicians. So we have work to do, but rather than seeing this as an obstacle, we see this as an opportunity. And then we ask things about the flu. Next slide. Now, then we did another survey, because we did the April survey, the September survey, and this is the most recent survey. We have one in the field even now. Do you believe that it's real? Again, 96.1%, that didn't change much. Have you been diagnosed? 19.4%, that didn't change much. But the death rates, we saw at 18.1%, but we saw a bump in, someone that has had COVID, and someone that has been hospitalized, bumped up a bit from September. Not a significant bump, but it was there. Next slide. Now, if the vaccine were available, we saw a glimmer of hope. If the vaccine were available today, would you get vaccinated? 28.6%. And I think those two slides were they're in a different order, but this is back to September, because this is when we asked this question. 28.6% now versus a lower number in April. And we saw a general trend of slightly increased trust, even with physicians now bumped up to 39.1% versus a first survey. The trust of Dr. Fauci and his group, it still held fast at 92.4%. But as time went on, there was less trust in the White House and President Trump and COVID-19, that information, and now only at 0.6%. Do you trust the other information? All of that, trust is key. You did not see any movement as it relates to the pharma industry, really, and the Surgeon General and all that. And once again, the most trusted partner for information was pastor, faith leader, a member of the church that we asked about, and that was the question, 78.3%, but still 20.8% unsure. Next slide. Now, key points, as I make sure I stay on time. And what we're often said, well, it's not really race, it's education, it's socioeconomics. When we compared levels of education and socioeconomics, the PhD versus a high school graduate were essentially the same with trust level and willingness to participate. Literally, there was very little movement, and our data was very tight with trust and trial participation. There was a difference in small areas of about 2 to 3%. Women were more willing to participate. That was a great variation. They wanted to receive and be open to receiving more information from trusted national, state, and local resources in our focus groups. And we did several of those with several hundred persons around the country. Local resources, state resources are very much trusted. Now, this is a caveat that we wanted to throw in, and it was quite telling. We also surveyed physicians and healthcare professionals, about 750, on 3 of the questions. They had hesitancy in participating in clinical trials, similar to the general public, which as a physician, that was disheartening to me. And these were, by the way, African-American professionals. Distrust at the pace of vaccine development, safety measures, and more importantly, hesitancy and recommendations to patients without extensive peer-reviewed studies came out of that survey. So we had work to do. And I do want to make sure I do say that this was an April survey. That was the first one. And as we know, this pandemic has been highly politicized, which we believe from our focus groups and the data even shown on the surveys that the political climate contributed a lot to the distrust, but distrust in the health community did not just start with this pandemic. Certainly in the notes and in our focus groups, we go all the way back to pre-Tuskegee. Everybody talks about Tuskegee, but we talk about slave health deficits and all of that, and that is ingrained. One of the things that has come out, we did a focus group last week. We can go to the next slide. We did a focus group last week on the 3 vaccines. And one thing that is popping to the top a lot with J&J's vaccine is their highly publicized issue with talcum powder. That kind of caught me off guard. But if you think about it, from the media and from all of the advertisements from lawyers, that popped up and is now driving, in some cases, persons, particularly African Americans, on social media and radio interviews and TV interviews. And when they are able to ask questions, to say, well, no, I don't want this particular vaccine because they did wrong with talcum powder and never told us, or I don't want this vaccine because it's not as good as Moderna or Pfizer, and the messaging is off. And I do want to say to everyone that has a physician, and what I did another interview last night, that all of the vaccines are 100% effective in keeping those vaccinated from having chronic disease and death. We have current project programs and outreach to really, our niche is to talk to African American communities and engage them where they are. The data is very clear. The faith community is not the answer, but it is one of the answers. And so first, you do not dictate to the faith community what to do and say to their congregants. We have held focus groups of pastors and leaders and say, what are you hearing? What do you want to do? How do we engage in this age of COVID electronically? What are your social media platforms and who do you trust? If we believe, and our latest survey has come out, if we believe that a sports figure getting on TV saying, I took the vaccine, you should too, is going to help our 69-year-old African-American woman that is a woman of faith, has diabetes, hypertension, and is a breast cancer survivor now change her mind, we are sorely mistaken. That is not health literate. That is certainly not culturally competent, but they will talk about and open up discussion in a community organization or some people that they see at the grocery store, go to church with, or know. And so those are part of our vaccination tactics, and to address the fear and distrust. Yes, there is distrust in the African American community, but we have to talk about the fear that this is experimental, the fear of side effects and all of that, and to make sure what we are finding that we break it down and not say you're going to be febrile. No, you're going to get hot and your temperature may go up, but that is normal, etc. Very clear language, and clearly state the safety and the process. That is what is working for us, and we continue to see some movement as it relates to African Americans. I am in Prince George's County, or near Prince George's County, and this is the highest per capita income of all African Americans in the nation, and we have lots of work to do with these highly educated and some would say affluent African Americans, who many are saying, I am waiting on the vaccine. And so we have work to do, and it will take us all. I hope I did not go over time.
Perfect. Thank you so much, Dr. Alice-Nati. Now we're going to go to our second polling question, and I'll go ahead and launch that now. And I'll let you read and respond accordingly. Have you ever participated in one of the following roles in research? None, patient subject, study advisor, member of a study advisory board, member of a study focus group, co-investigator, or other. Give it just another moment. I see some people still logging in their response, and then we'll share. We understand you may have multiple answers here, but you can give the one most frequently or the one that you would like to identify with. So let's share the results. And what we see is that 43% have not participated in research, 32% have been patients or subjects in a research project, 4% study advisors, 9% a member of study advisory board, 26% as study focus group participants, 5% as co-investigators, and 7% as other. Thank you for sharing that. Now we're going to go to our third poll question. And I'll launch that poll. Why do you not want to participate in research? I don't want to be a guinea pig. I don't trust researchers. I don't know how to get involved or where to find out about clinical trials. I do participate in research, or other. Again, we'll give everybody just a moment. We would expect that about 50% of you would say I do participate based off of our earlier response, but we'll see how these numbers shape up. Just one more second. Looks like we've got about 3/4 of the vote in, so I'll go ahead and end the poll and share the results now. So 14% are very honest and say they don't want to be a guinea pig, and certainly we respect and understand that concern. 8% don't trust researchers. 23% really don't know how to get involved or where to find out about clinical trials. And this is the most common thing that we hear from the community as well. So that's why we've developed certain tools and resources at Allergy and Asthma Network to help you. But then 47% say they do participate in research, and 14% say other. So again, thank you all for participating and logging in your response. And now I'm going to turn it over to Mary White, our research study patient advisor. Mary, share with us a little bit about your journey and why you got involved in research.
Hello, everyone. I'm so glad to see that everybody's on board. I'll tell you a little bit about myself. I wanted to know more about what was happening in my community and to families. When you have children with asthma, you tend to want to get education. You want to be educated. And with all that being said and done, you have to trust your medical professionals. And by asking them questions and trying to get data on where our chronic illness comes from or what we can do about it to improve our quality of life while having this particular conditions. I got involved with the research, with studies, because I felt as though knowledge, and everyone in my community, I live in Dorchester, Massachusetts. And if you did if you followed through with that data, we are one of the highest levels of asthma rates in the city. There's a couple comparison, but Dorchester has a high rate. So I was asked after going to the doctor with my children over and over because of respiratory issues. One doctor, I remember one doctor, after knowing everyone in the ER, one doctor asked me a simple question: where do you live? When that particular doctor asked me that question, she didn't just ask and not listen to my concerns when I told her where I lived. She told me about research and some studies that were out there, and they wanted to talk to people who lived where I lived. Now, I want you guys to understand something. Some people want to be involved in studies, but they're ashamed of where they live or how they live. It's not because of, no, we're not lazy. We just don't have funds to move into the nice White House on the hill with the gated fence. With the picket fence, we can't do that. So the bottom line is this. When you hear of something in the hospital, after you've been there, when you go to the hospital or other places, you will see little stickers. They're not very large, everyone, they're small. And it'll say, we want your input. We want to know what you think, or are you interested in being in a study? Or we want to hear what you think. I was one of those individuals, not just myself. There are a couple of us community leaders and parents, because there was a compassion for us. We wanted to make a difference. And what I have to explain to everyone, when you are part of a study, don't say, well, I don't want to do it because they're going to come and get my information, or they're going to give me medication. They're going to do this, do that. Ask questions. Find out what they're going to do with the data once they received it. You have to, it's like with your children, accountability. If you take your children to school, you want to make sure they're there. You want to talk to the educators. You want to know what they're learning. You want to know what their syllabus is. The same thing with research studies. No one's going to look down on you, but your information is so crucial. It's so important. When I heard the data that Dr. Allison Odie, hearing what she was saying made a lot of sense. And if you paid attention, people, even though some of us are not all the same religious faith, but it's amazing how you will know that fear, you can't do much with fear. So they trust faith organizations. But at this point, we have common sense and we can pray and do what we need to do. But I would love to let everyone know that there are studies out here, and you can't say, well, that's not about me. I can't. If you don't tell what's going on, or you don't tell anybody what your feelings are or how you feel about something, it will never be better, community. It will never get better. I love that individuals, when they said they were 43% didn't know about studies. That means in your community, something's wrong, because information should be out there so they'll have an opportunity to want to participate. And you know what we do here in our city? If we know of a study or some research project coming up, we make them accountable. When I say accountable, I'm not going to put some big university names out there, even though I want to. I'm not talking about Harvard or anything, but when they come into your community and ask questions and want to get information from you, then you should be able to suggest and say and demand that individuals come back and give you a report and data of what they received from your people in your community. And when I say your people, I don't care about what race or ethnic background or religion. If people are coming in and asking you questions about what your input and how you feel about something, and they're listening and writing down all what you're saying, I think it's so important that you demand that they come back and let you know what their findings were. So can go on and on, guys, but I really want you to take advantage of this. This COVID thing is real, and it's going to go away if we work together. If you hear about a focus group or something, study or something going on, be a voice. Tell your family members, tell your friends, speak to your elders. My mom is 83. My mother said to me, and she's a very prayerful woman, my mom wants the vaccine. Another community member who works along with me and volunteer with me, her mom had it and she's doing fine. The only difference
I believe we may have lost
do
me.
is ask me. You understand? So what I want everyone to do is take advantage, ask questions, take this serious, keep practicing safe. Please wear your mask and do the small groups and pay attention. I hope I didn't bore anybody.
Not at all, Mary. You never bore us. So thank you so much for sharing your story and again, encouraging others to be more actively involved in research.
Thank you.
Now, I'm going to turn it over to Courtney Clyott, and she is going to give us an update from PCORI. Courtney?
Hello, and thank you for that introduction, Tanya, and thank you, Dr. Adi, and then Mary, for sharing your experience in being involved in research. I think it's so important for folks to hear from others about their experience and really to dispel those myths that are out there so that we can really truly tell the story of our lived experiences. And I think that that's one of the key things that PCORI likes to get across, is that we understand that patients and caregivers are the experts of their own lived experiences. So I'll move into my slides. So my name is Courtney Clyott, and I'm a senior program officer with the PCORI Engagement Award Program, and I serve as a program officer for this project. So I'm pleased to speak with you today and tell you a bit more about patient-centered outcomes research, what we call PCOR, and what makes PCOR different from traditional research paradigms. Next slide, please. So first I'll start by telling you a bit more about PCORI, where I work, and then I'll share with you some of the ways to get involved with us as patients and healthcare consumers. So PCORI is an independent, nonprofit, non-governmental organization organized by Congress in 2010 out of the Affordable Care Act. And PCORI funds comparative clinical effectiveness research, or CER, that engages patients and other stakeholders throughout the research process. It also supports the work that will improve the methods used to conduct such research, like patient and stakeholder engagement. And these efforts that we seek to support, we hope that they will answer real-world questions about what works best for patients on their circumstances and concerns. Next slide, please. So for all the advances that healthcare research produces, traditional healthcare research has not always answered the many questions that patients face. And people may want to know what option is best for them. And their clinicians may be seeking to really have a better understanding of research findings. And so PCORI, as I said, seeks to support those efforts to answer those real world questions. Next slide. So as I mentioned, so these are examples of questions that patients may have. They may be curious about when choosing between healthcare options, what should they expect will happen to them if they take a certain medication or follow a certain treatment regimen? What are the options that provide them with the best potential benefits or what could be the harms of taking certain medications. And then also, what can they do to improve their outcomes? Because your lived experience is going to be important. If you are a person who may have diabetes and you have the opportunity to take a pill rather than having to inject yourself with insulin, you have to weigh what's best for you. You may work in a situation where you won't have that time to be able to stop and take your insulin if say you're working in a setting that is really demanding. So, it gives you a sense of what you should do and what works best with your lifestyle. Next slide, please. So patient-centered outcomes is a relatively new form of comparative clinical effectiveness. And it helps to differ in a sense from the research paradigm because it considers patient needs and helps to answer what works best for them. It investigates what works for whom and under what circumstances, and then helps patients and other healthcare stakeholders to make better informed decisions about healthcare and healthcare options. So patients and stakeholders from across the healthcare enterprise are actively and meaningfully involved in the entire research process, from the development of those research priorities, then to the dissemination of those research findings. And most importantly, patients are treated as partners in research and not just subjects. On this slide here, I would just show you what PCORI funds. And in general, we fund conditions that heavily burden patients, families in the healthcare system, health issues that are chronic or multiple conditions, rare diseases and understudied conditions, as well as conditions with varied outcomes across subpopulations. Next slide. So here on this slide, you'll see that PCORI has funded, as of June of last year, 14 research studies focused on asthma with a total of about $49 million. Next slide. At PCORI, we believe that better research can be done through engagement. Next slide. So by engagement in research, we refer to the meaningful involvement of patients, caregivers, clinicians, and other healthcare stakeholders throughout the research process. As I said, again, from the topic selection, so whatever your research question is going to be, and then to the conduct of research, and then the dissemination of those results. So as Mary mentioned, it's important for researchers to be able to close that feedback loop, give that information to those communities with whom they're working. You've taken information from the community. It's only right for researchers then to let the community members know, this is what we learned from you and your life experiences. And so by engagement in research, we do believe that effective engagement of patients and stakeholders in research allows for inclusivity with their influence, with an influence on projects. So it'll allow projects to become more patient-centered and perhaps even more relevant for those communities with whom they're engaging. It also helps to establish a sense of trust and legitimacy with the research findings. And often, there have been mentioned during our presentations this evening that there's sometimes mistrust or distrust. And why is that? Because folks maybe aren't transparent on what has happened through that research process. So effective engagement can help to eliminate the opacity that one can experience when they're going through a research process. And with effective engagement, we do recognize that engagement can take many forms. And so it does vary by the nature of the research. And because of that, we don't require any specific research activities, engagement activities, but instead we do encourage that all of our applicants bring their most creative engagement ideas forward. Sometimes that engagement idea is around ensuring that parents may have childcare if necessary, or having town hall or community meetings where there's food present, or providing transportation, as well as providing standard equal compensation. This slide here shows you what is our depiction of engagement as being a pathway to reach useful and high quality research. So we believe that such engagement processes can influence research to be more patient-centered, useful, and trustworthy, where researchers and partners are working together to create clearly defined defined and respected roles. There's co-learning, there's fair compensation for patients and stakeholders, and they're not treated as subjects, but they're really treated as partners. There's open and honest communication, and of course, that piece of closing that feedback loop. We do also have a process by which we allow patients to provide some guidance about what PCORI should fund, and that's through our merit review process. And then of course, closing that feedback loop also relates to sharing and sharing the research findings. Next slide, please. So in the process of engagement, because engagement is one of the key pillars upon which PCORI operates, it's really integral to our work. And so we basically make sure that we engage with all of the folks that are outlined on this slide. And we recognize that through the focus on engagement, we believe that patients and stakeholders, including payers, clinicians, health systems, and policymakers, they're able to be actively and meaningfully involved in the research process. And this allows these communities to then also guide our activities and help us to know what research to fund. It's also important to note that we realize that individuals may be members of several different communities, and as such, so we find it valuable to recognize that there are multiple perspectives, because at one time or another, we're all going to be a patient or a healthcare consumer. Next slide, please. Next, I'd like to share with you some of the opportunities for engaging with PCORI as patients and healthcare consumers. So this slide here just outlines the various ways that you can engage. And the next slide, I'll touch on a few of them in the next couple of slides. So in this slide, this is our ambassadors program, and our ambassadors are volunteers. They're not necessarily representatives of PCORI, but they are our boots on the ground, and they are our voice about making sure that people are informed about patient-centered outcomes research and really what that means and how they can then become involved. And to become an ambassador, you can fill out an interest form on the PCORI website and complete a short online training. Next slide, please. This next slide here is in reference to our merit review, and this is the process by which PCORI determines which research projects we'll fund. Our merit review panels include scientists, patients, and other stakeholders, and they all bring a diverse perspective to the review process. So in the research application, it is assigned to 3 scientists, 1 patient, and 1 other stakeholder. And so stakeholders and patients can bring their own lived experience as their expertise in being involved in determining what research gets funded. Scientists are expected to have an advanced degree in their field, also have relevant peer-reviewed publications, and be actively involved in a research program. Next slide, please. And then I want to share with you a bit more information about some resources for engagement practice that we have. We do have a training called Research Fundamentals. It's a learning package, and it's available on the PCORI website. It allows you to move at your own pace, and it allows you to learn kind of how to work together in a research environment. Really, as I said earlier, clearly defining roles, ensuring that there is ample compensation, and ensuring that all voices are heard during the process of research. So from the development of those research ideas, then to the dissemination of that research. Next slide, please. The importance of the research fundamentals objectives include increasing stakeholder understanding of PCOR/CER and basic research principles, enabling all team members to understand their respective roles, contributions, and assets, and then enabling all team members to obtain skills and learn behaviors to work successfully in a multi-stakeholder environment. Next slide. This is just an example of what you'll see in the 5 different learning modules. Next slide. And then here on this last slide here, prior to my last slide, this slide here gives you a link to the various ways that you can become involved with PCORI. We do currently have openings on our advisory panels, and here I've listed them: health disparities in delivery research, patient engagement, clinical trials, rare disease, and clinical effectiveness in decision science. This link here gives you the opportunity to click on the link and then see what those panels are in need of, and then also apply to be a member of that panel. The application process, I believe it closes on March 31st, and you can find out more information on the website. We do also have a peer review process, and then we also have our engagement resources. We call it our engagement tools and resources repository, that it provides some helpful engagement tips and tricks that have been created by our previously funded awardees. And as I said, that's all available on PCORI's website. At the bottom of this slide is a link to subscribe to PCORI's newsletter. And it's my understanding that the slides will be made available after our presentations. And so next slide. This slide here has my contact information, and I guess I'll turn it back to Tanya. So thank you for your time today.
Wonderful. Thank you, Courtney. Such an informative discussion. Now we're going to turn to your questions. So I'd like for you to go ahead and put any questions in the question box, and we'll get to as many as possible here in our last few moments together. We already had a number of questions come in, so let me go to some of those. The very first question is, are there different vaccines for adults versus children? Perhaps Dr. Graham or Dr. Alasnati, would you like to address it?
This is Dr. Graham. There are vaccines that are available for both. They are, to my knowledge, mostly the same vaccines. Dr. Alasnati has other information I'm hoping to share.
Yes, so right now for children, only I think it's the Moderna or Pfizer can be used in teens 16 and up. I think 16 or 17 is the cutoff. And there are national clinical trials, international clinical trials for use in children. So none of the vaccines right now, unless there's something happened in the last 24 hours, are approved for use in children yet. However, there are massive clinical trials going on, again, internationally now, to get approval in that area.
Great, thank you both. The next question says, are females more prone to actually contract COVID? Dr. Alasnati, why don't you take that one?
Actually not in any, and I want to combine this with another question I saw in the chat. We have seen worse outcomes, actually, if you look at the total data in females, but no, it is more so gender versus not. And this could, remember, be totally different in 6 months when more data comes out. It is our diabetics, our hypertensives, our persons with heart disease and pre-existing conditions, and the elderly. And because, and I am an internist and geriatrician by training, because females do live longer, if you look at the population in nursing homes, et cetera, you have more deaths in that area. But is that gender related, or we just outlive men and the population is skewed? The other part that I saw in chat and have heard on radio interviews and some TV interviews that ask questions is sterilization. Do the vaccines cause sterilization in women or men? And the answer right this moment is no. There's been no definitive link, and that is being shown as a myth. Now, again, as we have millions vaccinated, we will see these vaccines over the next 5 to 10 years. You will see different things pop up, but no, sterilization is not a risk factor.
Great, thank you so much for addressing that. Now, the next question actually was around the comments that you made on vaccine efficacy, Dr. Alasnati. I want to give you the opportunity to clarify. So we talked about the fact that the J&J vaccine has been proven to be about 72% effective in protection against COVID versus the Moderna and Pfizer at greater than 90%. However, confusion in the chat around the 100% factor that you gave. And so I want you to clarify that, and I'll also share kind of what we've been sharing with the patient community consistently after.
So this is what, number one, if somebody can just help me out and put this in the chat. Number one, all 3 vaccines are equal in this. 100% of vaccinated persons in the clinical trials, they had no deaths in the vaccinated persons, whether it was Pfizer, Moderna, or J&J. So they were 100% when we say effective in preventing severe disease and death. Okay, that is one thing. Efficacy means in protecting you from getting the virus. And your numbers are absolutely correct. 67 to 72% with J&J, Moderna and Pfizer greater than 90. But one thing that's coming up, and this is on communication style, which is my big thing. They're effective in keeping you from getting the complications, severe complications and hospitalizations and death is at 100%.
Yes.
Now, there are no head-to-head studies, so you cannot compare Moderna to Pfizer to J&J's. That is an unfair comparison across the board, because to do it scientifically, you would have to have a head-to-head study. Does that make sense? Did that clear that up?
Yes, thank you for clarifying that. And that is so consistent with what we will put in the chat, but also what we've been sharing in all of our COVID webinars and engagements with patients. 100% effective at keeping you out of the hospital and keeping you alive. All 3 vaccines.
Yes.
And that's what's important. Thank you. All right. Our next question. Has there been any research on the side effects of the COVID-19 vaccine? If you received the first vaccine, for example, and then had side effects of COVID vaccine, would you be more likely to have side effects the second time around? So talk about the side effect profile of the vaccines.
Is that for me or Dr. Graham?
You can take it.
Okay, so the side effect profiles, I like to be very basic. Number 1, a needle is going in your arm, so you're gonna have arm pain, period. Okay, so now muscle pain, arm pain, soreness is number 1. You are getting a vaccine. So similar to flu, measles vaccine, when you were kids and all that, you can have an elevated temperature, headaches, some shakiness. All of those are part of, and go to cdc.gov to look at side effects, but those are the top 3. Now, what we're hearing, and what I personally, I am vaccinated, I have the Moderna vaccine, is the first vaccine, I was a little sore and just felt a little headache for a day. The second vaccine, several weeks later, I was more sore and I had a headache for 3 or 4 days and I felt very tired. That is consistent with the second vaccine, and that's out there in the media. The second vaccine often will have almost a rebound effect or more of an effect. My mother is 81, had no issues with either one of the vaccines at all, no headache, no fatigue, etc. Increased temperature, and the issue is your body is mounting an immune response. And if you look online, go to cdc.gov, you will see that in some ways you do want a little bit of something, your body's saying, hey, something is different, because it could indicate that you are mounting a good response. It doesn't mean that you have to have a response. Everyone is different. But those are the major side effects. If you have a rash, which is now being seen, people are coming, and it's less than 1% that they get a rash that goes away in a few days, call your physician. And those are the major things. Chills, rigors, on the more, and rigors just mean hard chills, like you have the flu, have been seen in some of the cases with particularly Pfizer and Moderna in the second vaccine.
This is Dr. Graham. I would just like to echo what Dr. Al-Sankati said. And in fact, those symptoms that you get are indicative that your immune system has indeed responded. So while it's somewhat disquieting, it's actually a sign of efficacy, and very important. My wife and I are both physicians, and we both challenged each other, to be honest about it.
Great. Thank you both for that. All right. Our final polling question: has this session changed your mind about participating in research? And we'll go to launch that poll now. And you can log in your response: yes, no, or I already participate. Give it just a moment and see all the responses of the hundreds of participants that we've got on the line this evening. Again, thank you all for your continued participation in the Black People Like Me program. This is the 4th session, so we have 2 more sessions on the books, and there'll be more information forthcoming about those. But let's go ahead and end the poll here and share the responses. So it looks like 55% of you say that this has changed your mind about participating in a positive way. 30% of you already participate, and 15% still say not quite sure, not planning on participating at this time. So again, we appreciate your honesty and your feedback. It's so very valuable as we continue to develop these programs. Again, I want to remind you about our Facebook group, as well as our integrating inspirational imagery and quotes activity. So over the past month, we've been collecting quotes and finding inspiration from these quotes, and then sharing them with our moderator of our Facebook group, Leonis Quinn. So please, Charnette Darrington Zaskota and Leonis Quinn have been very active in sharing these. We would encourage you all to do the same. Stay creative, stay social, stay engaged in our closed Facebook group. Feel free to share your honest feelings and feedback. And then finally, again, I just want to thank you all for your time this evening, for your participation. I want to encourage you to participate in our Asthma 360 registry and our COVID-19 registry. Again, you can always visit Allergy Asthma Network for more education materials and also the playback of our webinars on COVID and other topics. Please mark your calendars for April 8th. That is when we'll have our next session for the Black People Like Me series, April 8th at 5 p.m. Again, thank you all for listening and participating, and we look forward to seeing you in our next session.